My name's Elgene Lim. I'm a clinician scientist based in Sydney. I run a research lab at the Garvan Institute in Sydney, and I also work as a medical oncologist at St Vincent's Hospital. I started off doing medical school in Melbourne, following which I then went on to do specialist training in medical oncology. So a major turning point was when I decided to pursue a PhD after completion of my medical oncology training. That then put me on a path to pursue a PhD at the Walter Eliza Hall Institute in Melbourne, where I studied the origins of breast cancer through studying breast cancer stem cells in patients with germline BRCA1 and 2 mutations. And the research identified the culprit cells that cancers arise from. That then set me on a journey to pursue more research training at the Dana-Farber Cancer Institute in Boston, where I trained under Professor Miles Brown and Professor Eric Weiner, who are world-renowned leaders in the field of cancer research. And subsequent to that, I came back to Australia to set up my own research group. My current research focuses entirely on breast cancer. I focus on a subtype of breast cancer called the hormone receptor positive breast cancer, which is treatment has been transformed with the use of anti-hormonal therapies. However, many women develop resistance to these therapies, and my lab focuses on understanding why some breast cancers respond to these therapies and some women don't. And what we try to do is to develop novel therapeutic strategies for women who have resistant disease. One of the projects we're currently working on is the evaluation of a patient's response to anti-hormonal therapy prior to surgery. So approximately 90% of patients will have a very good response to anti-hormonal therapy even in that 2 weeks of treatment prior to surgery. However, 10% of patients will not have a response to that anti-hormonal therapy, and that group of patients have a high risk of having their cancers come back. So what we've been able to do is, through a clinical trial, run novel therapeutics in this group of women with hormone receptor positive breast cancer to identify these patients who will not respond to standard anti-hormonal therapy, and then try to better understand what's driving the resistance their cancers have to anti-hormonal therapies. The National Breast Cancer Foundation is a major funder of my research. I've been awarded the National Breast Cancer Endowed Chair in Australia. That's a 10-year program of funding. We also obtain government-funded research grants through the National Medical and Health Research Council, as well as through generous donors through the Garvan Foundation. The passion in my work comes solely from my patients, and I'm fortunate to be able to see patients on a daily basis, and understanding their journey, understanding their perspective gives me the inspiration and passion to do the research that I do. Clearly, for many patients, therapies that we have today are not good enough, and we need to do better, and that's the whole reason for doing research. My other passion is cooking. I love cooking all different types of food, learning to cook and learning to understand other cuisines. It's a little bit like doing a little experiment, understanding the key ingredients and how to utilize them, and obviously, as a result, cooking for friends and making everyone happy.